Health insurance seems to be a necessity this day and time. With the rising cost of healthcare in the United States, having an insurance policy definitely helps, as long as you're not having to pay way too much for it. In 2010, the Affordable Care Act was signed by President Obama and mandated to take effect in 2014. On August 30th, 2013, final regulations for the individual mandate were published and had corrections completed by December 26th of 2013. This was signed into effect with three different purposes in mind. The first was to make affordable health insurance available to anyone who wanted it or needed it. The law itself provides patients or customers with subsidies that will lower the cost of premiums for households with incomes below the federal poverty level. A subsidy is assistance that the government gives to help a consumer pay their premium monthly. For example, say a consumer has a policy whose total premium is $150. The government then takes your income and equates it in and comes up with an amount that they feel that you can pay, and then they pay the difference of it. So with our example, if your policy costs $150 prior to the subsidy given by the government, the government decides that you should be able to pay $50 of the $150. This leaves them, the government, paying $100. This is the subsidy that they are giving to you. This is extremely beneficial for those who are in very low income households. The second goal of the ACA was to expand the Medicaid program to cover all adults that have income below 138% of the federal poverty level. Some states have done this and others have not. The third goal was to support innovative medical care delivery methods designed to lower the cost of health care generally. All of these steps were taken to make health care more affordable to the consumer. Opinions differ on whether people feel it has been effective or not. There are ways, though, to choose what type of policy you want and what works best for you and your family. In order to choose the most effective plan, you would need to follow a few steps. The first step would be to find out where you would be buying your policy from. Through the Affordable Care Act, if your employer offers health insurance that is affordable, you do have to accept it. However, if it is not affordable, through their guidelines, you can go through the healthcare marketplace to purchase a policy or through the individual company to purchase. The only way to receive a subsidy is by going through the healthcare marketplace. There are a number of companies, and the individual would need to see which company offers the best policy for the lowest premium rate. Once you figure out where you'd like to buy the policy from, you would need to compare policies. There are several types of policies, and it can get very confusing. The four types are HMO, PPO, EPO, and POS. HMO stands for Health Maintenance Organization. PPO stands for Preferred Provider Organization. EPO stands for Exclusive Provider Organization. And finally, POS stands for a Point of Service Plan. A HMO plan typically has a lower out-of-pocket cost and has one primary doctor that coordinates the care of the patient. That includes ordering tests and working with your specialist. You usually have to have referrals to see doctors outside of the primary care physician. You also have to stay within the network to get coverage as well. A PPO plan, on the other hand, you do not have to stay in network, but the care is less expensive if you do. This policy is for those who want more provider options and no required referrals. An EPO plan, a patient would have to stay in network except for emergencies. This policy does not require referrals. This plan is best if a consumer wants lower out-of-pocket costs, but no required referrals. Finally, a point of service plan, POS, does not require you to stay in network for coverage, but in-network care is less expensive and does require a referral to go out of network. This is also for the consumer that wants more provider options and a primary doctor that coordinates care for you, which also includes the ordering of tests and working with your specialist. Once deciding what type of policy you want, whether it be HMO, PPO, EMO, or POS, you have to compare health plan networks. Costs are always lower when you go to an in-network provider because they're contracted with that particular company at lower rates. Out-of-network providers are contracted and cost both the company and the consumer more. You also need to compare out-of-pocket costs. A plan benefit summary would spell out any of the out-of-pocket costs for services. As the person purchasing the policy, the words that are going to mean the most to you as far as cost are deductible, co-insurance, and co-payments. A lot of times the lower premium, the higher out-of-pocket costs you will have. Picking plans should be based upon the consumer and their family's needs. Financially, the smarter choice for a person who rarely ever has to go to the doctor and that is in good health is the higher out-of-pocket cost and the lower monthly premium, meaning their deductible would be higher, but the premium would be lower each month. The person that has to go to the doctor more regularly and does not have very good health would probably need to pay a higher premium monthly, but would have a plan that would pay at a higher portion. In the end, this person would pay less in premiums than they would monthly in the cost of their health care. Next, the consumer would need to compare benefits. After choosing the type of plan they are wanting, they would need to go to the summary of benefits that the plan offers. Certain things need to be considered when choosing this. What medications are covered? What maternity services are covered? How much are the copays for primary care providers, specialists, and emergency services? All of these things need to be considered. Finally, choose the company and the plan and send in all the information they need to get you started. These companies usually require premiums to be paid up front to give the plan an effective date. Effective dates are usually at the beginning of each month. Choosing which company and plan can sometimes be overwhelming. However, if you follow these steps, doing so will be easier. Considering all options gives a consumer the best possible plan for the best possible premium rate. Researching each company and looking at their reviews would help the consumer to pick as well. Regardless of the plan, the most important thing is that the consumer and the patient gets the most affordable health care that we all deserve. Thank you.